If you're over 50 and taking supplements every single day because you think they're protecting your heart, your brain, your bones, and your energy, this might shock you. Some of the very supplements marketed specifically to people over 50 could actually be working against you. Not because supplements are bad, not because nutrition doesn't matter, but because your body at 50, 60, or 70 is not the same body you had at 30, and what helped you then could silently hurt you now. So today we're going to talk about the supplements you should seriously rethink if you're over 50, why they can backfire, and what smarter alternatives might look like. As we age, our metabolism shifts. Our liver processes nutrients differently. Our kidneys don't filter as efficiently. Hormones decline. Stomach acid drops. And inflammation tends to creep up. All of that changes how your body handles vitamins, minerals, and herbal extracts. So that more is better mindset. It doesn't work anymore. In fact, in some cases, more becomes dangerous. Let's start with something extremely common. High-dose calcium supplements. For years, people over 50, especially women, were told to load up on calcium to prevent osteoporosis. It became almost automatic. Reach 50, buy calcium tablets. But here's the issue. When you take large doses of calcium in supplement form, especially 1,000 milligrams or more in one shot, your blood calcium levels spike unnaturally fast. That's not how the body evolved to absorb calcium. Food-based calcium enters slowly, along with cofactors like magnesium and vitamin K2. But isolated calcium supplements can increase the risk of arterial calcification in some individuals. That means instead of going into your bones, calcium can deposit in your arteries. And arterial stiffness is the opposite of what you want as you age. Your heart health matters more than ever after 50. Now, I'm not saying calcium is bad. Calcium is essential, but megadosing calcium without considering vitamin D balance, magnesium intake, and K2 status is where the problem begins. Many people over 50 would be better off focusing on leafy greens, sardines, sesame seeds, and weight-bearing exercise instead of relying purely on pills. Next, let's talk about iron supplements. This is a big one. Unless you've been diagnosed with iron deficiency anemia and confirmed by blood work, taking iron after 50 can be risky. Men and postmenopausal women especially do not lose iron regularly the way younger women do. Iron accumulates, and excess iron in the body is linked to oxidative stress and inflammation. High iron stores have been associated in research with increased cardiovascular risk and even neurodegenerative issues. Your body has limited ways to actively remove excess iron. So blindly taking iron for energy when you don't need it can slowly create problems you don't see coming. If you feel tired after 50, it's rarely just iron. It could be low B12, poor sleep, thyroid imbalance, blood sugar instability, or chronic stress. But iron is often added into multivitamins automatically. So if you're over 50, check your labels. Many high-quality multivitamins for seniors intentionally remove iron for this reason. Now let's talk about vitamin A, specifically high-dose preformed vitamin A, also known as retinol. Vitamin A is fat-soluble. That means it builds up in your tissues. And over time, excessive intake can stress the liver and even contribute to bone thinning, ironically increasing fracture risk instead of reducing it. After 50, liver detoxification slows slightly compared to younger years. Taking high doses of vitamin A through supplements, especially if you're also eating fortified foods, can push you toward toxicity without obvious symptoms at first. Safer forms include beta-carotene from colorful vegetables, which your body converts as needed. That built-in regulation matters more as you age. Another supplement people over 50 should be cautious with is high-dose vitamin E. Decades ago, vitamin E was promoted heavily for heart protection, but studies later showed that high-dose isolated vitamin E supplementation didn't consistently reduce heart disease risk and in some cases might increase bleeding risk, especially for those on blood thinners. And let's be honest, many people over 50 are on medications like aspirin, warfarin, or other anticoagulants. Combining those with high-dose vitamin E can increase bruising and bleeding complications. Speaking of blood thinning, let's talk about ginkgo biloba. It's marketed for memory and brain health, which sounds appealing as we age, but ginkgo also has blood-thinning properties. If you're on prescription blood thinners or even daily aspirin, stacking ginkgo on top can increase bleeding risk. Brain health matters deeply after 50, but herbs are still biologically active compounds. They're not harmless just because they're natural. Now let's address high-dose niacin, especially the kind used for cholesterol management. Niacin can help improve lipid profiles in certain cases, but high doses can stress the liver and affect blood sugar regulation. For someone over 50 already dealing with insulin resistance or prediabetes, taking high-dose niacin without supervision can complicate things. And the flushing form of niacin can be uncomfortable and misleading, making people think it's working harder because they feel it. But sensation isn't always effectiveness. Another one that surprises people is potassium supplements. Potassium is essential for heart rhythm and blood pressure control. But over 50, many people are on medications like ACE inhibitors, ARBs, or potassium-sparing diuretics. Adding extra potassium on top of that can push levels too high, leading to dangerous heart rhythm disturbances. Unlike sodium, high potassium can become life-threatening quietly. That's why prescription potassium is carefully dosed. If you want more potassium, food sources like avocados, spinach, and beans are generally safer because your kidneys regulate dietary intake more effectively than concentrated pills. Let's talk about testosterone boosters and hormone-boosting supplements. After 50, hormone levels shift naturally. Some companies exploit that fear of aging by selling natural testosterone boosters, or DHEA supplements. DHEA is a hormone precursor, but once you introduce hormone precursors into your system, you're influencing complex endocrine pathways. In some individuals, DHEA can convert into estrogen or other hormones unpredictably. It can worsen prostate issues in men or cause unwanted hormonal effects in women. Hormone balance after 50 should be guided by labs and medical supervision, not marketing claims. Now, here's another one people don't expect: high-dose vitamin B6. B vitamins are water-soluble, so people assume they're always safe. But chronic high intake of B6, especially above recommended upper limits, has been linked to nerve damage and neuropathy. Ironically, many people over 50 already experience tingling or numbness due to blood sugar issues or B12 deficiency. Taking excessive B6 can worsen nerve symptoms instead of helping. Let's not forget about green tea extract supplements in concentrated form. Drinking green tea, wonderful. But concentrated extracts, especially on an empty stomach, have been associated with liver stress in some cases. As liver resilience decreases slightly with age, mega-dosing plant extracts becomes riskier. Whole food forms tend to be gentler and more balanced. Then there's beta-carotene in high-dose synthetic form, particularly for former smokers. Some studies showed increased lung cancer risk when high-dose beta-carotene supplements were given to smokers. That doesn't mean carrots are dangerous. It means isolated, high-dose synthetic compounds don't behave the same way as nutrients inside food matrices. Let's talk about magnesium for a second because this one is nuanced. Magnesium is beneficial for many over 50, especially for muscle cramps, sleep, and blood pressure. But certain forms like magnesium oxide in high doses can cause digestive distress and diarrhea, which in older adults can lead to dehydration and electrolyte imbalance. The form matters, the dose matters, the reason for taking it matters. And here's the bigger message underneath all of this. After 50, your body becomes more sensitive to imbalances. your margin for error shrinks slightly. Your kidneys and liver still work beautifully, but they don't appreciate unnecessary overload. The supplement industry doesn't always adjust its marketing for aging physiology. It just increases the fear-based messaging. Another supplement worth reconsidering is high-dose zinc taken long-term. Zinc is critical for immunity, especially as immune function changes with age. But chronically high zinc intake can deplete copper levels. Copper deficiency can lead to anemia and neurological problems. Balance is everything. And what about fish oil? This one depends heavily on dose and quality. Moderate omega-3 intake can support heart and brain health, but extremely high doses, especially combined with blood thinners, can increase bleeding risk. And poor quality fish oil that's oxidized may create more inflammation than it reduces. Quality control becomes more important after 50 because inflammation management becomes central to longevity. Here's something many people don't think about: supplement interactions with medications. After 50, medication use rises statistically. Blood pressure meds, statins, diabetes meds, thyroid meds. Supplements can alter absorption or potency. Calcium can interfere with thyroid medication absorption. St. John's wort can interfere with antidepressants and heart medications. Grapefruit extract can alter liver enzyme activity. Even natural compounds can shift how your body metabolizes drugs. And let's zoom out for a second. Why are so many people over 50 reaching for more supplements? Often it's fear of aging, fear of memory loss, fear of heart disease, fear of bone fractures, and fear makes us vulnerable to aggressive marketing. But what actually moves the needle most after 50? It's not mega doses, it's consistency, it's sleep quality, it's strength training to preserve muscle, it's balanced blood sugar, it's anti-inflammatory whole foods, it's social connection and stress reduction. If you are over 50, the smartest supplement strategy is usually minimalist and targeted. Instead of stacking 10 random pills, get lab work. Check vitamin D levels before supplementing high doses. Check B12 if you feel fatigued or have nerve symptoms. Assess ferritin before taking iron. Personalization beats guesswork every time. There's also the issue of supplement quality. The industry isn't regulated like pharmaceuticals. Some products contain more than the label says, some contain less, some contain contaminants. After 50, you want third-party tested products and conservative dosing. Another overlooked risk is fat-soluble vitamin stacking. Vitamins A, D, E, and K accumulate. Taking multiple supplements plus fortified foods can unintentionally push you above safe thresholds. More is not always better. In fact, optimal ranges often sit comfortably in the middle, not at the extreme high end. Let's talk about multivitamins specifically formulated for 50 plus. Some are well designed, others are just marketing. Watch for unnecessary iron. Watch for excessive vitamin A. Watch for mega B6. A good multivitamin for over 50 should reflect aging physiology, not generic adult needs. And here's something empowering. Your body at 50 is incredibly intelligent. It has adapted, survived, learned. It doesn't need to be flooded. It needs support, gentle, intentional support. Before you take any supplement, ask yourself 3 questions. Do I have evidence I need this? Is the dose appropriate for my age and health status? And could this interact with anything I'm currently taking? The goal after 50 isn't to chase youth through pills, it's to build resilience. Strong muscles reduce fracture risk more than calcium tablets alone. Stable blood sugar protects your brain more than random nootropic blends. Real food antioxidants support longevity more reliably than isolated high-dose extracts. Supplements can absolutely play a role. Vitamin D for those deficient, B12 for those with absorption issues, magnesium for sleep or muscle health, omega-3s when dietary intake is low, but targeted, measured, thoughtful. If this video makes you pause and look at your supplement shelf differently, that's a good thing. I'm not telling you to throw everything away. I'm telling you to stop assuming that more equals better, especially after 50. Aging is not a disease. It's a biological transition that requires smarter strategies. Talk to your healthcare provider, get proper testing, prioritize whole foods, lift weights, walk daily, protect your sleep, manage stress, hydrate, and if you supplement, do it with intention, not impulse, because after 50, the real power move isn't swallowing more pills. It's understanding your body well enough to know what not to take. Once you cross the age of 50, your body is no longer operating on the same hormonal blueprint it did in your 20s or even your 40s. Hormones shift. Some decline gradually, some fluctuate unpredictably, and some become more sensitive to even small changes. That's completely natural. But what's not natural is flooding your system with over-the-counter hormone-related supplements without understanding what they actually do inside your body. And this is where things can quietly start to go wrong. Hormone-related supplements are heavily marketed to people over 50. You see promises of restoring youthful testosterone, balancing estrogen, boosting thyroid function, increasing metabolism, melting belly fat, improving libido, sharpening mental clarity, and reigniting energy. The messaging is powerful because it targets very real concerns that many people experience in midlife and beyond. Lower energy, weight gain, brain fog, decreased muscle mass, reduced sex drive, slower metabolism. These changes feel frustrating, and supplement companies know that. The problem is that hormones do not operate in isolation. They function in a tightly regulated network. When you influence one hormone, you often influence several others downstream. And once you're over 50, your endocrine system is more sensitive to disruptions because the feedback loops have already adjusted to aging physiology. Adding hormone precursors or stimulators without medical supervision can tip the balance in ways that are not immediately obvious. Take testosterone boosters, for example. Many over-the-counter products claim to naturally increase testosterone using herbal blends like Tribulus terrestris, fenugreek extract, tonkat ali, or D-aspartic acid. Some of these ingredients may influence hormone signaling to a small degree, but the reality is that testosterone regulation involves the hypothalamus, pituitary gland, and testes in men, and the adrenal glands and ovaries in women. It's not a simple on-off switch. When you artificially stimulate testosterone production, even mildly, your body may respond by adjusting its own feedback signals. In some individuals, especially older men, altering testosterone balance without monitoring prostate health can increase prostate-related concerns. The prostate is highly sensitive to androgens. Testosterone converts into dihydrotestosterone, or DHT, which plays a strong role in prostate growth. As men age, benign prostatic hyperplasia becomes more common. That's non-cancerous enlargement of the prostate, but it can cause urinary symptoms, disrupted sleep, and discomfort. If someone with an already enlarged prostate starts taking hormone-boosting supplements, they may unintentionally worsen those symptoms. And because these supplements are sold as natural, people often assume they are harmless. But biological activity is still biological activity. It's not just men who need to be cautious. Women over 50 often explore hormone-related supplements for menopausal symptoms. Products claiming to balance estrogen or progesterone frequently contain phytoestrogens, black cohosh, wild yam extract, or DHEA. While some of these compounds may offer symptom relief for certain individuals, they also interact with estrogen receptors throughout the body. Estrogen affects breast tissue, uterine lining, bone density, brain chemistry, and cardiovascular health. Introducing hormone-like compounds without evaluating personal risk factors can complicate things, especially for women with a history of hormone-sensitive conditions. DHEA is particularly important to talk about. It's a hormone precursor produced by the adrenal glands, and it declines with age. Supplement companies market DHEA as an anti-aging solution because it can convert into both testosterone and estrogen, but that's exactly the issue. It doesn't convert in a predictable, uniform way in every person. Depending on your body composition, enzyme activity, genetics, and baseline hormone levels, DHEA can shift in different directions. In men, it might raise estrogen more than expected. In women, it might increase androgen-related side effects like acne or hair thinning. And in both sexes, it can potentially stimulate hormone-sensitive tissues. Now let's talk about thyroid-related supplements. After 50, thyroid function can slow subtly, and symptoms like fatigue, weight gain, dry skin, and cold intolerance become more noticeable. Many people assume their thyroid is underactive and start taking over-the-counter thyroid support formulas. These often contain iodine, selenium, tyrosine, ashwagandha, or even desiccated glandular extracts. The thyroid gland is extremely sensitive to iodine levels. Too little iodine can impair function, but too much iodine can also disrupt thyroid hormone production. In fact, excessive iodine intake can trigger hyperthyroidism in some individuals or worsen autoimmune thyroid conditions like Hashimoto's thyroiditis. Autoimmune thyroid disease becomes more common with age, particularly in women. If someone with an undiagnosed autoimmune condition starts taking iodine-heavy supplements, they may experience increased inflammation in the thyroid gland. Symptoms might fluctuate between hyperthyroid and hypothyroid states, creating confusion and instability. Without proper lab testing, TSH, free T3, free T4, thyroid antibodies, there's no way to know what your thyroid actually needs. Ashwagandha is another ingredient commonly included in thyroid support supplements. It's known as an adaptogen and can influence stress response pathways. In some cases, it may slightly increase thyroid hormone levels. That might sound beneficial for someone with low thyroid function, but if you already have borderline or normal levels, pushing them higher can cause palpitations, anxiety, or sleep disturbances. Hormonal systems are not meant to be forced upward without precision. Metabolic boosters are another category that deserves attention. After 50, metabolism naturally slows due to muscle loss and hormonal changes. Instead of addressing muscle mass through strength training and adequate protein intake, many people turn to fat-burning supplements that claim to rev up metabolism. These often contain caffeine, green coffee extract, synephrine, yohimbine, or other stimulants. While not hormones themselves, they influence adrenal hormones like cortisol and adrenaline. Chronically stimulating the adrenal system can worsen blood pressure control, increase anxiety, and disrupt blood sugar regulation. Blood sugar management is particularly important after 50 because insulin sensitivity often declines. Some metabolic supplements contain ingredients that influence insulin signaling or glucose metabolism, such as berberine or chromium. While these compounds can be helpful in specific cases, they can also interact with diabetes medications. If someone is already on metformin or insulin and adds a supplement that lowers blood sugar further, they risk hypoglycemia. And hypoglycemia in older adults can increase fall risk and cognitive impairment. Prostate health supplements are another major category. Many contain saw palmetto, beta-sitosterol, pygium, or zinc. Saw palmetto may influence DHT levels, which can affect prostate tissue. In some men, it provides symptom relief. In others, it may alter hormone balance in subtle ways. Zinc is often included because it plays a role in immune function and prostate health, but high doses of zinc over time can deplete copper levels, leading to anemia and neurological symptoms. Balance matters. Then there's the issue of combining multiple hormone-related supplements at once. Someone might take a testosterone booster, a thyroid support formula, and a metabolic fat burner simultaneously. Each product individually claims modest effects, but together they may significantly alter endocrine signaling. The endocrine system thrives on rhythm and feedback. When multiple pathways are stimulated simultaneously, the body can become dysregulated. Sleep is another area where hormone supplements are common. Melatonin is widely used and generally safe at low doses. However, high doses taken long-term may affect natural melatonin production and interact with other hormonal pathways. Melatonin also influences reproductive hormones and immune function. More is not better. One of the most overlooked issues is that symptoms of hormonal imbalance often overlap with other conditions. Fatigue can stem from anemia, sleep apnea, depression, nutrient deficiencies, chronic stress, or medication side effects. Weight gain can result from reduced activity, increased calorie intake, muscle loss, or insulin resistance. Brain fog can be related to poor sleep, dehydration, or blood sugar swings. Jumping straight to hormone supplements without identifying the root cause can delay proper diagnosis and treatment. After 50, regular lab monitoring becomes more valuable. Hormone levels fluctuate throughout the day. A single blood test provides a snapshot, not a full movie, but it's still far better than guessing. If someone truly has low testosterone confirmed by labs and symptoms, medical supervision allows for monitoring of prostate-specific antigen levels, hematocrit, and cardiovascular markers. If someone has thyroid dysfunction, treatment can be adjusted carefully with follow-up testing. Another concern is that some over-the-counter hormone products are not standardized. Dosages may vary between batches. Labels may not fully reflect the active compounds present. Quality control in the supplement industry is inconsistent. When you're influencing hormones, precision matters. Even small variations can have noticeable effects over time. Cortisol is another hormone that deserves attention. Many supplements claim to balance cortisol. Some attempt to lower it, others to increase adrenal output. Cortisol follows a circadian rhythm. It should be higher in the morning and lower at night. Disrupting that rhythm can affect blood sugar, immune function, and sleep. After 50, circadian regulation can already be more fragile. Adding cortisol modulating supplements without understanding your stress patterns can worsen fatigue or insomnia. In women after menopause, estrogen declines significantly. Some turn to phytoestrogen supplements hoping to compensate. Phytoestrogens bind weakly to estrogen receptors. In some tissues, they may act as mild estrogens. In others, they may block stronger estrogens. The net effect depends on the individual's baseline hormone levels and receptor sensitivity. Without guidance, it's impossible to predict the outcome precisely. Men dealing with declining libido may use supplements containing maca, horny goatweed, or other botanical extracts. While some of these may influence nitric oxide pathways or mild androgen activity, they can also interact with blood pressure medications or heart conditions. Sexual health is important, but cardiovascular stability is foundational. Another layer to consider is liver metabolism. Many hormones are processed through the liver. As we age, liver function remains strong in healthy individuals, but it may become more susceptible to overload from multiple supplements, medications, and alcohol. Introducing several hormone-active compounds increases the liver's workload. The psychological effect of hormone marketing also plays a role. When people believe they are hormonally deficient, they may attribute every symptom to that narrative. This can create dependency on supplements rather than addressing lifestyle foundations like strength training, sleep hygiene, balanced nutrition, and stress management. Muscle loss after 50 is real. But the primary driver is reduced resistance training and protein intake, not simply testosterone decline. Supporting muscle mass naturally through movement has far broader health benefits than attempting to manipulate hormones with pills.